Welcome back to Trust the What. You all know who I am.
By what name are you known?
There are some who call me Tim.
All right, let's talk about GLP-1 drugs, because if you spent more than 7 seconds on the internet lately, you've probably seen the ads, celebrities, dramatic music, before and after photos, and of course, lose weight, feel amazing, become the best version of yourself. Let's roll the clip.
On Roe, 34 pounds down on GLP-1s. Healthier on Roe. Supported on Roe. FDA approved GLP-1 options. Now even in a pill. Weight loss expertise I trust. I'm moving better on Roe. I'm feeling better on Roe. I'm Serena Williams. This is me on Roe.
Wow, that's a lot of promises packed into 30 seconds. So today, we're going to do something radical. We're going to look at the fine print. Promise 1, 34 pounds down. Sounds incredible, right? But let's look at the numbers. If you look at the screen, you'll see that average weight loss in manufacturer trials was about 14 to 20% over 1 year. That's the highest doses of the medication and paired with diet and exercise. Meanwhile, people who did diet and exercise alone lost 2.2 to 3.1 of their body weight in the same time. Now, to be fair, that's a meaningful difference. But let's also remember something important. These results are based on manufacturer trials, and I'm sure there was absolutely zero bias in those trials.
You sure about that?
Promise 2, healthier. Well, yes. If you improve your diet and exercise regularly, your health will probably improve. That's not a pharmaceutical breakthrough, that's just a Tuesday. Promise 3, supported. The ad says you'll be supported. So what does that mean? Let's look at the example message they show on the screen. Looks like you're ready for your next refill. So supported is making sure that you never run out of the drug.
Got it.
Promise 4, FDA approved. Now let's talk about the magic phrase, FDA approved. That sounds incredibly reassuring, but history suggests we should maybe not worship those 3 letters. Let's review a few things that were once FDA approved. OxyContin, approved in 1995, advertised as less addictive. Then came the opioid crisis. Next up, Accutane, an acne drug used from 1982 through 2009, later linked to birth defects and severe mental health issues. Then we have red dye number 3, a petroleum-based food dye that caused cancer in male lab rats, still approved. And finally, Resulin, a diabetes drug approved from 1997 to 2000. It was recalled after liver failure. So yes, FDA approval is important, but it's not the same thing as perfectly safe forever. Promise number 5, trusted weight loss expertise. Let's read the small print. In clinical trials, patients who lost weight saw lowered glucose levels and reported improvement in knee joint pain. You want to know something wild? If you lose weight with diet and exercise, your glucose levels improve and your knees hurt less. And the best part, you don't need a monthly prescription refill reminder to get there. The fine print nobody reads. Now let's talk about the warning label. You know, the one that flashes on the screen for about 5 seconds while happy music plays. It says, see important safety information about GLP-1 medications, including boxed warning. And it briefly mentions that the drug should not be used if you or your family has a history of thyroid cancer, because in mice, these drugs caused thyroid C-cell tumors. But that's just the beginning. Let's take a look at the side effects. Common side effects. Ready? Here we go. Nausea, diarrhea, vomiting, constipation, abdominal pain, headache, fatigue. Next we have dyspepsia, which is the medical term for indigestion, because apparently saying that your stomach feels like it's on fire is too casual. Then we have dizziness, abdominal distension. That's a fancy way of saying that your stomach swells up like a balloon. Belching or burping. Hypoglycemia or low blood sugar. Flatulence, also known as farting. Gastroenteritis, which is basically stomach flu. And then GERD, where stomach acid comes back up your esophagus. You know, just another normal Tuesday evening. The serious side effects. Now, let's talk about the serious ones. These are rarer, but still worth mentioning. First up, thyroid tumors, or thyroid cancer. Next, acute pancreatitis. Now, that sounds cute. It's not. It means your digestive enzymes produced by your pancreas activate early and start digesting your pancreas. That is not adorable. Then we have gallbladder disease, which can require emergency surgery, acute kidney injury, which can cause waste products to build up in your blood. Also not cute. Then we have severe gastrointestinal reactions, which include intense nausea, vomiting, diarrhea, and abdominal pain, sometimes severe enough to cause dehydration. Next, serious allergic reactions, diabetic retinopathy complications, which can lead to vision loss or blindness. And finally, pulmonary aspiration during anesthesia, which means if you're under anesthesia, food from your stomach could travel into your lungs, not exactly what your surgeon ordered. So why do people take these? Good question. To answer that, we need to understand what GLP-1 actually is. GLP-1 stands for glucagon-like peptide 1. It's a natural hormone produced in your gut. It helps regulate blood sugar and appetite. That's right, your body already makes GLP-1 on its own. How to increase natural GLP-1? And there are ways to increase your natural production. For example, eat fiber-rich foods like oats, beans, lentils, broccoli, and Brussels sprouts. Increase lean protein like eggs, fish, yogurt, and lean meats. Use healthy fats like olive oil and avocado. Eat slowly and chew thoroughly. Studies show that eating meals slowly over 30 minutes increases GLP-1 release. You can also improve GLP-1 levels by eating protein and vegetables before carbohydrates. The foods like fatty fish, avocado, tea, and cinnamon also may help stimulate GLP-1. So, what do the drugs do? GLP-1 medications like Ozempic and Wegovy mimic the hormone. They increase insulin release, slow stomach emptying, reduce hunger signals in the brain, which leads to less hunger, less eating, and weight loss. But here's the interesting part. Remember the earlier number? Average weight loss with the drug was 14 to 20%. Without the drug was 2 to 3%. So the medication produced about 7 times more weight loss. That sounds amazing until you hear this. The concentration of GLP-1 medications is roughly 1,000 times higher than the natural GLP-1 levels in your body. Let me repeat that. 1,000 times higher to produce 7 times better results. That math is not mathing. Also, natural GLP-1 breaks down quickly. These drugs are designed not to break down, so they stay active much longer, meaning your body is being exposed to hormone levels it was never designed to experience. The long-term question. Semaglutide, the active ingredient in many GLP-1 drugs, was approved for weight loss in 2021. That's only about 5 years ago, which means the long-term effects are still unknown. History suggests we should probably stay curious. The weight regain problem. Here's another interesting statistic. 82% of people regain at least 25% of the weight they lost after stopping GLP-1 medications, and 17 to 18% regain all the weight or even more. Why? Because the drug works by suppressing appetite. Once you stop taking it, hunger comes back, often with a vengeance, which means for many people, the drug becomes a lifelong treatment. Translation, stop the injections, and the weight may come back. A personal note. Now look, I get it. I've spent a good portion of my life overweight or obese. Right now, I'm actively working on losing fat myself. My focus is reducing visceral fat. That's the fat that sits in your abdomen and wraps around your organs like your heart, liver, pancreas, and kidneys. It's the fat we really want to get rid of. My goal with this video. If you're watching this video, there's a good chance you're thinking about losing body fat. This video isn't here to tell you never take GLP-1 drugs. And it's not here to tell you you must take them. That decision should always be made between you and your doctor. This is simply about understanding the pros and cons. The hard truth. I truly believe most people can lose excess body fat through a proper diet, high protein intake, minimal processed foods, exercise, calorie control, and intermittent fasting. But let's be honest, that path is not easy. Here's a quote worth remembering from Teddy Roosevelt, who once said, "Nothing in the world is worth having or worth doing unless it means effort pain, difficulty. I have never envied a human being who led an easy life. I have envied a great many people who led difficult lives and led them well. Your 1% challenge. So here's my challenge to you. Pick one thing you can start today to improve your health. Just one. Aim to become 1% better today than you were yesterday. Stack another habit tomorrow, and the next day, and the next. A year from now, you'll be 365% better than you are today. Drop a comment below and tell me what's your 1% improvement goal. If you found this video helpful, hit the like button. If you know someone struggling with weight loss, share this video with them. And if you want more content that questions conventional health advice, hit subscribe and ring the notification bell so you never miss the next episode of Trust the What. Thanks for watching.